Thanks for having me, Katie. My name is Paul, Paul Tran. I go by Paul to everyone who's not my patient. I am a pediatric GI doc, and I would consider myself a part-time clinician and part-time educator. Now I hold several roles in medical education, including in teaching first and second year medical students clinical skills or doctoring, being a co-clerkship director for a pediatric clerkship, and then a lot of mentoring and medical education research.
So I wanted to ask you too, because I think one thing that we've spoken about offline a lot is a shared interest in changing the culture of feedback. So obviously that's something that a lot of medical students are very interested in. They're constantly looking for feedback. They want to hear about how they're doing so that they can do the best, they can impress you. So, what would you say to the medical student who is really being mindful of when to ask questions, they're being curious, and they don't want to wait until the middle or towards the end of their rotation to hear back from their attending, but they're very nervous to approach their attending because they don't want to be annoying or they don't want to get only negative feedback? How would you tell that student to approach their attending or their resident or their fellow and elicit that feedback?
What I would tell this student is, by the way, feedback that you're going to get is going to suck at some point.
Right.
It doesn't matter how many people hear about getting or giving good feedback or being good educators. There will always be feedback that's horrible, that's vague, that's mean, that's non-specific. Let's say that becomes a minority someday. It's going to still happen. So I think that you have to have an attitude of feedback is a gift, and you can choose what you will do with gifts. Not every gift is a desirable one. Not every gift is something that you can't wait to open. Not every gift is something that you're going to use every day. Some gifts you set aside, you re-gift, you throw away. You get to choose what to do with the gift. But yeah, I have a kind of deliberate practice method to be able to approach this for students in any rotation. Non-specific feedback comes when people don't really know what to say about what you're working towards. So I think it starts with expectations and then goals and then feedback based on those goals and constant checking in. So I'll lay it out. Let's say you are working with an attending for 5 days. Early on, ideally Monday, 5-minute conversation. Hey, can I talk to you today, just after rounds? I just wanted to touch base with you and say, I really want to do well on this rotation. What are your expectations of a third year medical student? What are your ideas of what a really good student looks like? And then you can use that to be like, oh, I clearly have a deficit in generating a differential diagnosis. I'm going to say that. I can't ever think of more than one
Mhm.
diagnosis. And their expectation was you generate a well thought out differential with at least 3 to 5 differential diagnoses. And you want a SMART goal, specific, measurable, achievable, attainable, realistic, and timely. So by the end of this week, for every patient that we see together or I present, I want to be able to give you at least three differential diagnoses. And then every single day, Tuesday, Wednesday, Thursday, hey, how am I doing on my goal? And then on Friday, you reflect. Hey, all week you've given me feedback on developing these differential diagnoses. I think I've done a pretty good job of it. I had a couple patients with fever, with general symptoms that I was able to generate this. I think I struggled a little bit yesterday with the kid with diarrhea, but yeah, I think that's been really helpful to me. You have to end it with the next step. You ask for advice,
Mhm.
not feedback.
Mhm.
And when someone gives you advice, they're investing in you. So, what advice, Dr. Patel, would you give me to move on with differential diagnoses generation at like a sub-I level, at an intern? Not everyone's going to engage, but man, you give opportunities for people to engage. And that's all you can hope for as a student.